We are going to discuss today the concept of a fatty liver and what this means to a person's health. Fatty liver means that the liver has been now inundated with visceral fat, which is the inner fat, and it will cause a lot of complications. What causes a fatty liver? There are many diseases which can lead to a fatty liver. Most importantly is obesity, overweight, high cholesterol, diabetes, a history of hepatitis, a history of hemochromatosis, a history of Wilson's disease, which means too much copper, alcoholism, or using high-risk medications which can affect the liver, like cholesterol medications and some of the new medications for rheumatoid arthritis and so on. All this may actually lead to a fatty liver. Now, in the past, we didn't really pay too much attention to the fatty liver because, honestly, we didn't know what it meant and what are the complications of a fatty liver. Today, we know that fatty liver has become the most common cause of liver failure and transplant in women in the United States. This fatty liver concept has surpassed hepatitis and alcoholism as causes for liver transplant. There is now an effort from all the boards, the American Board of Internal Medicine, the American Board of Gastroenterology, the American Board of Endocrinology and Internal Medicine, to try to identify patients before liver failure and cirrhosis will actually happen. Now let's talk in the past about something that used to be called cryptogenic cirrhosis. And when you say cryptogenic, it means that we didn't really know what the cause is. And we use this cryptogenic in other diseases when we don't know what the cause is. Well, it turns out that this cryptogenic liver failure, which is called cirrhosis, were actually secondary to obesity and fatty liver. And again, in the past, we just had, okay, well, lose some weight and let's see what's going to happen. Nowadays, we have at least 2 medications that we can use in order to prevent the development of liver failure and cirrhosis. Now, let's see how we approach a patient who comes to you with any of the indications that I was telling you about: obesity, overweight, high cholesterol, diabetes, high blood pressure, dangerous medications, history of alcoholism, history of copper disease, and so on. Then the physician has to do a certain tests to ascertain whether the fatty liver is present. And it can be done by blood tests. However, the blood tests will not identify if this fatty liver is advanced or not. And here comes something that's called a FibroScan, which is a new tool, non-invasive, which has been instrumental in identification and treatment of patients before cirrhosis occurs. This FibroScan sends a wave into the liver externally, completely non-invasive, no radiation, and will give us 2 numbers. The first number refers to how much fat the liver has, and the second number identifies if the liver already has fibrosis, which is a scarring of the liver. Now, the history of the FibroScan is interesting, and, anecdotally and from a mythology point of view, it is said that the person who actually invented the FibroScan and discovered the FibroScan was a French physician who noticed, and we knew that the consistency of liver is pretty much the consistency of cheese, and in order to ascertain whether the cheese is ripe or not, you actually press on the cheese and see what type of bounce it has. That's exactly what you do with the liver. You send this wave, and then the return of the wave will tell us if it has fatty liver or fibrosis. The moment the patient has fibrosis, which is the very beginning of liver failure, if it's stage 2 or 3 or 4, then we have medications which we can treat the patient with. One of them is a derivative of the thyroid hormone, and the second one is called Wegovy, and it's semaglutide, just like Ozempic. It's the same molecule, but it's been approved for the treatment of the liver issue. Of course, all these medications have to be done and have to be given to the patient in relationship to a good diet and exercise program, and not completely just medications, because they are probably not going to work as well. But do remember to ask for a FibroScan if you have any of those indications, because you can prevent liver failure. And this is something literally mandatory at this point in time. Again, if you have obesity, you are overweight with high cholesterol or high blood pressure, you are taking dangerous medications, you have a history of alcoholism, you have a history of hepatitis, you have a history of copper overproduction or iron called hemochromatosis, and there are some other indications.